Okay.
Greetings to Madam Maisara. So today my group and I are going to talk about first aid and emergency planning. My group members are CHELVAPALANEE, Erica Lane CASTOR, SASHWIINIE and Ranjitha. So for the introduction, I'm going to explain what is first aid. First aid is the provision of immediate care to a victim with an injury or illness, usually affected by a lay person and performed within a limited skill range. First aid is normally performed until the injury or illness is satisfactorily dealt with, such as in the case of small cuts, minor bruises and blisters, or until the next level of care, such as paramedic or doctor arrives. Next, permission to render first aid to an unconscious victim is implied, and a first aider should not hesitate to treat an unconscious victim. To sum up, basic training in first aid skills should be taught in schools, colleges, and in workplaces because first aid is an important skill and should be taught to everyone who has the ability to learn. Next. So for the key aims of first aid are preserve life of anyone involved in the accident. Next is protect any unconscious person. Also prevent any further injury or existing injury becoming worse. And lastly, promote recovery of casualty. So next, I'll pass to Erica.
So now I will be presenting on the sign and symptoms for the scenario 1 and also scenario 2. So in scenario 1, it tells us about an adult leader went on a hike at the extreme elevation or can be also called as high altitude. And on the other hand, the leader starts experiencing the altitude sickness or also known as mountain sickness. And this condition is basically happens when traveling to the place that has a high altitude or elevation too quickly. For example, hiking at the extreme elevation may cause such nauseous or lightheaded and even sometimes shortness of breathing. And hence, these symptoms happens when our body was trying to adapting to the lower pressure and also lower oxygen levels at high altitudes. So the sign and symptoms can be can be seen through in a different level of altitude sickness. So the first one is the symptoms of mild or short term, term sorry. The first symptoms is symptoms of mild or short-term altitude sickness, which these symptoms is usually begin at 12 to 24 hours after arriving at the high altitude. And it may lessen in a day or two as our body was adjusting. And the symptoms include dizziness, fatigue, and loss of energy, shortness of breath, loss of appetite, as well as sleep problems. Next is the symptoms of moderate altitude sickness, which these symptoms are more intense and will be worsened instead of improving over time. It includes worsening fatigue, and shortness of breath, and having problems of coordination, and can be facing difficulty to walk, and having severe headache, nausea, and vomiting, and also chest tightness and or congestion, and lastly is difficulty in doing a regular activities, but still be able to walk independently, which this means that a person was still able to walk independently but having some kind of difficulties to do or to conduct their regular activities. And the next is severe altitude sickness, which is severe altitude sickness can be put into an emergency where the symptoms are similarly to moderate AMS but more severe and intense. And basically, AMS stands for atypical measles syndrome, it is an altered expressions that may cause a sudden fever, headache, cough, and abdominal pain. In this situation, if happening to an individual, the individual should be taken to a lower altitude immediately for a medical care. And then the symptoms that can be seen, such as shortness of breath even when they are resting, and also having difficulty to walk, they are inability to walk, and then can be in a state of confusion, as well as fluid are built up in the lungs or brain. Next, we go to HAPE. HAPE stands for high altitude pulmonary edema, which these symptoms are happens when the fluids have built up in the lungs, and it may prevent oxygen from moving around the body parts, and it is absolutely requiring a medical treatment. And the symptoms that can be put is a cyanosis. Cyanosis is where the skin, nails, or white eyes, or white of the eyes has started to turn into bluish in color and can be in a state of confusion and irritational behavior, which means the patient is easily to get emotional disturbance. They are easily to get angry, irritating, and also annoying. And next is shortness of breath even when resting, tightness in the chest, extreme fatigue and weakness, and lastly is persistent cough, bringing up white water fluid. And then the last symptoms for scenario 1 is HACE, which stands for high altitude cerebral edema. HACE happens when the brain of the tissue starts to swell from the leaking of the fluids. And of course, HACE is also required an immediate medical treatment, which the symptoms can be seen such as headache, loss of coordination, where the person or the patient are unable to stand on their own, and also weaknesses, and be in a state of disorientation and have a possibility of memory loss, and being in a state of hallucinations, psychotic behavior, and lastly can be in a state of coma. So that is the so that is the sign and symptoms for scenario 1. Now we go to the scenario 2, which is was lying on the ground under a ladder, and he is in an obvious pain, and his arm is clearly broken with a piece of bone protruding from the skin, where we also call it as fracture. Yet the bone fracture happens when one of the bones become cracked or broken into multiple pieces, and it is also resulting in several injuries, accidents, or violent trauma. Broken bones usually not known as a life-threatening, but they do require an immediate medical care. So the sign and symptoms for a broken bone can cause one or more signs. For example, the patient may be experiencing an intense pain in the injured area that gets worse whenever the patient are trying to move to one location to another location. Then next is numbness in the injured part, and then the skin appearances can be turned into a bluish color, can be seen as a swelling or visible deformity, and also the bone protruding through the skin, which means the bone has gone beyond or extended out to the surfaces of skin. And lastly, is having a heavy bleeding at the injury site, which means whenever we have a protruding bone, we will have the possibility, a major possibility of having a very heavy bleeding. And that is the sign and symptoms for scenario 1 and also scenario 2. I will pass to my friend. That's all for me.
Next, I would like to present about prevention. First, scenario 1. On a hike at extreme elevation, an adult starts experiencing headaches, shortness of breath, and dizziness. There are ways to prevent the signs and symptoms which appear through the incident. First, we should prevent strengthened joints, and stay fit. Second, check pollen counts before going hiking. Third, avoid going directly to areas of high altitude if possible. For example, the newest will feel nervous if they are experiencing the hiking on the first time. Fourth, keep the water flowing into our body even if we don't feel thirsty. Fifth, try drinking less water or having a small snack or two to help process that water through your body. We should also avoid from drinking alcohol and smoking. And last, prevent body from getting warm and dry. Next. Next, I'm going to go to the scenario 2. A man was lying on the ground under a ladder. He is in obvious pain and his arm is clearly broken with a piece of bone protruding from the skin. First, we should use the ladder safely. Seems people forget or maybe don't know how to use a ladder safely, so they should use it well to avoid injuries or deaths. Second, inspect the ladder before using it. Always inspect a ladder before using it. Begin by checking the ladder's duty rating to see if it can support the weight of your body or your tool belt. Third, position the ladder carefully. It is very important to position your ladder properly before using it. For all ladders, always make sure the ladder is on level, solid footing, and be sure to position the ladder near your work so that you can not overreaching. This is the prevention for scenario 1 and scenario 2. I will pass it to Ranjitha.
So now I'll be explaining about the first aid management for scenario 1. As been told, an adult starts experiencing headache, shortness of breath, and dizziness on a high elevation, and how to handle situation. So at first, wear gloves just in case if you want to handle any body fluids to prevent ourselves to catch any infection from the victim itself. And number 2, since the victim is in the high extreme elevation, help the victim to a lower elevation, and from the symptoms given, the victim might need some help to bring him down. So the first aider might need to make their own stretcher using t-shirts and log as the picture provided below. And then after the victim has reached the lower elevation, give the victim a small sip of water. Do not give the water just in one intake. It might need sometimes to process it in the body. Number 4, continuously communicate with the victim and to see if the victim is feeling better or worse. Throughout this process, the first aider should ask the victim whether the victim has any medical conditions like such as asthma or any lung disease. And if the victim has any of diseases, and in number 5, we should keep on monitoring if the victim having asthma or more severe symptoms of the mountain sickness. And number 6, if usually the altitude sickness decreases once the victim has reached the lower elevation. But if the victim still having severe symptoms, call 911 and wait for paramedics to arrive. During this process, do not give any medicines, Panadol, we should not give. First aider has no rights to give any medication unless if it's a doctor. And for scenario 2, a man lying on the ground under a ladder. Obviously, he's in pain and his arm is clearly broken with a piece of bone is protruding from the skin. So at first, this is very severe case. So we should call 911 at first. And number 2, make sure it is safe to approach the victim and do not move the victim because there's a possibility of spinal injury causing from falling. And number 3, find any hazards nearby, such as electrical hazards or physical hazards, such as sharp tools, to make the process more easier and less infection or less accidents to happen. And number 4, wear gloves and provide urgent treatment by controlling the bleeding with a sterile gauze or a clean cloth around the wound. And try to keep the victim calm. This is very important because if the victim feels more pressure during the process, the bleeding might not decrease. Keeping the victim calm, the process will be more easier and the bleeding would decrease. And number 5, during the process, do not give the victim any intake of food or drink, even if the victims ask so, because since it's a very severe accident, once the victim has been sent to the hospital, doctors might need to proceed with the surgery. So during a surgery, the victim should not drink or eat. And number 6, since the bone is protruding from the skin, do not try to realign or push the bone, and this might be more worse if you try to push, or once the victim has sent to the hospital, doctors might felt it's more difficult to handle because once the bone has been moved, it's very, very severe according to the accident or according to the severity. And number 7, apply ice packs to limit swelling. And do not apply the ice directly on the skin. Wrap the ice with any cloth or towel and place on the skin. And this next process, it is only available if you are a trained first aider or you're familiar with tourniquet. Tourniquet is very dangerous and it's not encouraged to do so. Even during the tourniquet process, if you have a slightly mistake during the process, the victim might lose his arm. So make sure you are trained. If you are not trained, do not do the tourniquet. And if the victim are still bleeding, apply the steroid gauze around the bleeding to reduce it. And that's it for the first aid management. I'll pass to my friend.
Okay, so for the conclusion, as we conclude the final terms, we must act on time when a person is injured. Also, we must take care of the person the way it is meant, otherwise a valuable life might be lost. We need to understand how precious lives of people are and what importance first aid carries in saving this precious life. For example, in order to handle an emergency situation, immediately contact trained medical help early for definitive care and continuously communicate with the victim to see if the victim is feeling better or worse. Another essential point is keep monitoring the victim for other medical conditions. Besides, the signs and symptoms should also be identified for further understanding on why the incident happened. As the saying goes, without proper action at proper time, danger awaits us with a bigger fate. Thank you.